My name is Mackenzie Dinkert, and this is my legislator interview for Nursing 642, Healthcare Policy and Funding for Advanced Nursing Practice at Saginaw Valley State University. The topic that I chose to interview a legislator about was mental health policy. I chose this topic because there are many barriers in the system that prevent the public from holding behavioral health entities accountable and ultimately allowing the system to become inefficient and unable to meet the mental health care needs of Michigan residents. Just to go a little further into mental health policy, our mental health system has not done a very good job at protecting people with mental health problems. Hence why I chose this topic, because we could definitely benefit from some new policies being implemented regarding mental health. Just to show the prevalence of mental illness among Americans in 2019, just before the COVID pandemic hit, 19.86% of adults reported experiencing a mental illness. This is equivalent to about 50 million Americans. And sadly enough, about 24.7% of those adults that had a mental illness reported that they had unmet needs for treatment. And that percentage of adults that do report that has been increasing every single year since 2011. So it is very important that we shape our mental health system to ensure that everybody has access to treatment that is easy and affordable. We need to improve the quality of treatment that people are receiving. We need to also reduce homelessness, incarceration, and discrimination with mental health. Those individuals need to be treated with dignity. And also, early intervention and prevention definitely need to be prioritized. The individual that I chose to interview about this topic was one of our state representatives, Timothy Beeson. He is currently serving in his first term in the Michigan Legislature. He was elected to serve the residents of Bay County in 2020. I chose Timmy because he's a family friend of ours, so he was very easy to get into contact with. And he also serves on the Michigan Health and Human Services Appropriations Subcommittee. So he actually gets the opportunity to work on healthcare-related issues. Like I said, he is on the Michigan Health and Human Services Appropriations Subcommittee. When asking him if he has had the chance yet to work on any healthcare-related issues, his response was, yes, we get the opportunity to work on healthcare-related issues. Having no background personally in the field, I have learned a lot about how our state does a good job, and sometimes a bad one, at addressing this important topic that affects many Michiganders, the topic of mental health policy. Tim did mention that he doesn't have a lot of experience with mental health policy just yet, since he did just start serving his first term. But he did want to talk about a few other issues that he has had experience with so far in his term. So we talked about those a little bit. He talked to me about how COVID and the pandemic has played a huge part in many of the decisions that lawmakers and the governor make, and the best way to respond to the pandemic. He felt that many of the executive orders that were put into place went beyond the scope of the government's role, but he understands that we are all in, as he describes, uncharted waters during the height of COVID, and swift action, in his words, needed to be taken to ensure that residents were safe first and foremost. During this time, however, the legislature was able to tackle some other problems in the healthcare field, such as lowering the cost of prescription drugs for seniors and also granting more access to care. So he went on to talk about those a little bit more in detail, and then he actually gave me a reference to someone who has a little bit more experience with mental health policy that I wasn't able to get in contact with, but he did talk to me about her because he works with her very closely. So I'll talk about that in the next couple slides. Tim went into further detail about some of the laws that he was able to experience thus far in his term, one of those being with the opioid epidemic. He talked about a plan that is now law that ensures that all patients are given the opportunity to opt out of being offered, prescribed, or administered opioids from healthcare providers. Overprescription of opioids from healthcare providers is the root cause of opioid addiction. He gave me a very interesting statistic that a total of 2,684 Michigan residents died due to opioid overdoses in 2020. So this new law will require healthcare providers and insurers to make non-opioid directive forms available upon plan enrollment. These non-opioid forms not only allow patients to make their own medical decisions, but also bring patient awareness to alternative options to prevent initial exposure to opioids. I found this to be super interesting because I work in the ICU as a nurse, and I see many patients come in who take a whole handful of narcotics daily at home for back pain and, whatever that these certain doctors are prescribing them. I've seen people come in with overdoses who leave the hospital and are still prescribed these opioids, and I think that they are just being abused, and it is definitely something that we need to look into. And I think that this new law that they had passed will definitely help with the opioid epidemic, and I just think that it was very interesting. In addition to that law, Tim was also a part of the successful lowering of the cost of prescription medicine, increasing access to services, and providing a higher standard of care. Specifically, the House Bill 4348 will give patients better access to life-saving drugs like insulin and oral chemo. It helps to rein in the unregulated middlemen who have been manipulating drug prices. And it will also increase transparency in healthcare costs and make it easier for clinics, mental health facilities, and hospitals to add capacity. I think that prescription medicine costs is a huge issue right now. Again, working in the ICU, we've had so many people come in who are in DKA who couldn't take their insulin because they can't afford it, and it is just the most heartbreaking thing. So getting those prescription medicine costs lowered definitely needs to be a priority for our healthcare system. No one should have to suffer because they can't afford their medication that they need in order to survive. So this is another one of our state representatives. Her name is Mary Whiteford. It's one of Tim Beeson's colleagues that he works along with, and she is on the chair of the Health and Human Services Subcommittee, and she's also a member of the House Health Policy Committee. He mentioned her because he knew that my topic was mental health policy, and he said that she definitely has a lot more experience working on these issues, and he thought that it was also very interesting that she was a nurse before she decided to run for office. So in his own words, her expertise and knowledge of the healthcare field is unmatched. He's mentioned her as being a mentor of his, and that he learned a lot about this important industry in our state from her. So I looked a lot into things that she's been doing. I know I didn't get to interview her personally, but she definitely does have a lot more experience just regarding mental health policy specifically. And I think it's amazing that she was a nurse prior to running for office. I think that plays a huge impact on her being able to be a voice for all of us nurses and the healthcare field, because she's been there and she can kind of understand it a little more than others would be able to. So Tim and I talked a little bit about Mary and the things that she has been able to do in her terms that she has been running. And he mentioned how she was awarded in 2021 the Mental Health Champion Award by Mental Health America after she was nominated by our Mental Health Association of Michigan. They awarded her this for her dedicated work to establish and implement the Michigan Crisis and Access Line and efforts to improve access to health and support services. So definitely right on the ball for my topic of mental health. She has prioritized some of our state money for the expansion of mental health programs in Michigan public schools. She also supported adding more school-based health clinics that include behavioral health services throughout the state, which I think is just amazing. Tim specifically said that access to care is obviously critical for improving our state's mental health care system, and she helped to do just that. When she was awarded the Mental Health Champion Award, she stated that, as a registered nurse, I've always cared deeply about every aspect of healthcare, especially mental health care, and it has been my passion to improve access to the programs and support that people need to live happy, healthy lives. It has been so gratifying to see our work make meaningful change in the lives of Michiganders. So with her passion and her experience with being a nurse, she would definitely be my go-to girl if I wanted to reach out to her about things that I thought we needed to change about mental health policies or any ideas or things like that. She would be my person to talk to. Just back to the interview with Timothy. Just to kind of sum everything up, he mentioned that there's just so much more that we can do in the legislature to continue to streamline and clarify many of the problems we face in the healthcare field today. He's learned that the squeaky wheel does get the grease in Lansing, and if he continues to fight for what's good and right for our constitutes, he'll be able to provide more help to those who need it most. He also stated that he will continue to look for ways in which we can do better to give care to more patients and listen to those professionals in the field for guidance. Timmy mentioned that he definitely understands how much healthcare workers, how much we have endured, all of the hardship during this COVID pandemic, but he told me that our hard work and dedication to our profession and the welfare of others is truly heroic. So Timmy and Mary, too, of course, being in our profession, she and Timmy both definitely would be on our side, and they're going to stand up for what we want and be a voice for all of us. And those are two really great people to reach out to regarding policy change. Working in the healthcare field, we have a number of opportunities to enact change at the policy level, and we're able to contribute to these ongoing discussions about how our society can respond, especially to things like my topic, mental health. I've listed some ways that as a advanced practice nurse, how I could influence health policy. I think that one of the most critical ways that as a healthcare professional is to raise awareness in a stigma-free way, since there is so much stigma that surrounds mental health concerns, and the general public definitely lacks information about the nature of mental health conditions and the availability of care. So just raising awareness in a stigma-free way through either social media, blog posts, and traditional media would be a good way to start. Another area for potential influence would be drafting a local law or ordinance and place it before the public to be enacted. Generally drafting some basic policy language and finding enough petitioners. This would be a good way to raise topics to be considered by voters in our local government. I think that this would be a very powerful way to encourage our local authorities to weigh in on specific mental health policy changes. Another way to influence policy, specifically mental health, would be lobbying lawmakers and government agencies at the federal, state, and local levels. One of the most effective ways that I would be able to do this would be by joining an existing advocacy group. And another way to raise awareness, in addition to social media and blog posts and the media, would be by organizing local grassroots events, such as fundraisers or informational seminars, classes that are oriented towards parents, caregivers, or loved ones of people who are mentally ill. I think that would be very valuable. And I think another one of the best ways to start change is to just start with our own organization, encouraging new policies or cultural shifts among coworkers, family members, church members, friends, just counseling them to speak about mental illness in a stigma-free way, or simply just becoming more engaged in discussions about mental health policies. I think that mental health policy plays a major impact not only on the people who experience mental health issues, but also on their loved ones, their caregivers, and all of us in a societal sense. So it's definitely important to learn about the impact of policy and consider the ways that we as advanced medical professionals to be able to be a force for positive change. And that pretty much sums up my legislator interview on the topic of mental health policies, and also a little bit of extra policy changes that Tim himself got to be a part of. It was very interesting to look into what Mary has also done, specifically regarding the topic that I chose. I wish that I would have had a chance to interview her personally. However, I did get to hear a little bit about the things that she's done through Timmy, since he does get to work with her. And I also just looked up the things that she was able to be a part of. So it was very interesting to talk to Timmy and kind of get another side of how the legislation process works, and something that I don't have a whole lot of expertise in, just like he doesn't have the expertise in the healthcare field. It's definitely a good thing to combine both of our expertise to be able to influence policy change. So